Hi. We unfortunately the person who is supposed to represent IMCERT couldn't make it today, so I'm going to maybe just talk a little bit about IMCERT. IMCERT's it's a very valuable resource for us at the Youth Clinic. Stands for Integrated Mobile Crisis Response Team, and they previously were referred to as the Emergency Mental Health Team. So people may have remembered them as that team, and they are they operate from 1 to midnight, 1 p.m. to midnight, 7 days a week. And what IMCERT normally has a clinician who's available during that time, and they also are connected with a police officer if needed, if they do need to go to a home visit and check on somebody and possibly certify somebody if they're unsafe. The number for the for the IMCERT line is listed on your sheet there. They do have a pager number for physicians to call, and they welcome you to use it if needed, if you have a patient you're really concerned about in your office. I have to say I've called them on a few occasions and about a patient that I've been really worried about, just to let them know in case that patient calls them, just to give them a heads up. They'll tag them or flag them, and sometimes they'll even check up on them. They'll give them a phone call, and if they're worried at all, they'll go in and see that patient. So they're a huge, valuable resource, and they see youth, or they see all ages from 0 to whatever, but all the way from cradle to grave.
Thank you. So you guys have heard a little bit about the Victoria Youth Clinic based on some of the clinicians who are here. I'm the outreach worker at the Victoria Youth Clinic, so I don't come from a medical background. I come from a social work background. So Victoria Youth Clinic is under the umbrella of the Victoria Youth Clinic Society. We started our own society about 2 years ago. So we have our own board of directors, executive director, etc. We're primary health care in a walk-in clinic setting for ages 12 to 24, up to the 25th birthday. And we will support youth who are transitioning from the age of 25 onwards. We're not going to leave them hanging. We like to spend some time before their 25th birthday preparing with them where they're going to go afterwards. So we do the transition as well. Our staff includes our executive director, our medical office assistant. We've got doctors, nurses, outreach worker, myself, just one. We have 4 counselors who come in each day per week and work on an appointment basis. They are counselors who are for our youth who can't find counseling outside of the youth clinic. So, for example, may not have any other connections, may not have the money, or any coverage or anything like that. We do have a psychiatrist who comes in basically 2 half days per month. And she provides consultation and some assessments, again, for our youth who have absolutely no other connections generally. We're located right in the downtown core, so at 533 Yates, which is the same building as Youth Empowerment Society, but we are not affiliated with Youth Empowerment Society. We're the first floor in the back of the building. And we're open from Monday to Thursday, 11 to 5. Accessing services couldn't be any easier because you don't need a referral. It's a walk-in basis. As Jen Lee has mentioned, we don't say no to anyone. We don't turn anyone away. They don't need a care card. We will help them get a care card. So you don't need to refer anyone. You can just send them along, send them our way. Feel free to send any background information if the patient is willing for you to share that with us. Again, we're drop-in, we're a walk-in clinic. And me as an outreach worker, I'm happy to liaise with people who may be uncomfortable about coming to the clinic for the first time. So I'm quite happy to pick someone up or meet them in another environment and explain our services. 2 things to know: we're an integrated team-based care with a focus on substance use and mental health especially. Didn't necessarily start that way, but we kind of do a lot of that these days because, as we all know, the services can be limited. And again, we welcome everyone and anyone. Thanks.
Can I just ask a quick question?
Yeah.
So a lot of family docs in the audience crowd here. So in terms of a family doc having a youth who they feel like maybe they can't provide adequate care for, or
Yeah.
it's sort of things are a little out of their league in terms of that youth, having issues with homelessness or
Yeah.
other things, can they direct that youth to you guys, even
Yeah.
if they sort of are still their family doctor?
Absolutely. So, we do struggle with this a bit. Like if we have someone who comes in who has a really good connection with their family doctor, and it seems like it might be more appropriate for them to go back to their family doctor, we'll do that and we'll liaise with them. But absolutely, if the family doctor feels like it's out of their wheelhouse and sends them our way, we're happy to work with the youth. And sometimes we do have those extra services like outreach services that a family doctor may not necessarily have in regards to, for example, tracking down a youth where they are to remind them of appointments and that kind of thing. So send them our way, and I think collaborative care is the best care. So send them our way and give us a phone call.
Call or
Yeah, or send the youth in, but both email, fax. Yeah,
Awesome.
yeah, thanks.
Great.
Head honcho. Hi, everybody. I'll make this quick. So, Gordon, I want you to time me. I want to be under 2 minutes. So, give me this when it's 2 minutes. So, Discovery Youth and Family Substance Use Services. Anybody here not heard of us? Put your hand up. I know this is asking for courage, but okay, good. Okay. So check on your table. Here's a brochure. This is what it looks like. They're scattered around. I might have run out, but and if you want more, just call the office and they'll mail them to you at our cost. One-page referral form. You'll also see that on your table, perhaps, and if not, come by and see me, and I'll make sure you get one. We have it in PDF form as well for you high-tech folk.
Is it fillable?
I believe it is fillable, but don't quote me on that. I could be wrong, having never filled in a referral form to my program. But anyway, so some things that aren't in the brochure that I think are worth mentioning, because that was part of the kit that I got, how to prepare for this gig. So we use a family systems approach or a systems approach. So we try to find out from the young person who they're connected to, and we try to get them involved in the treatment if we can. We do community-based counseling. When I say treatment, that's what I mean, community-based counseling. Substance use is our main interest in terms of working with people, but we also recognize that people don't come with one problem. People usually have multiple issues, so we deal with mild to moderate other issues because they usually come in company. And we also take a contextual view on things, so we know that in order to understand why something's happening, you have to look at their environment and what's going on. So we get into that a little bit. So that's how we do it, that's different. So we really look at a contextual view of a problem as opposed to trying to figure out the etiology of the problem. A plus B equals C, we don't really do that so much. We've got 10 clinicians. Our geographic area is the South Vancouver Island. About 50% of our work is done in the community, not in our office. So basically we'll go wherever it's convenient for the clients to go. And we split ourselves up in terms of geographic locales. So some areas that require different services that frequently don't get enough services, they let us know, and we try to ensure that we've got them covered as well. So we try to cover that. The other thing that might not be obvious is that we also work with kids that are affected by substance use, so they can be using substances but also affected by their parents' use. We'll work with them. And lastly, we'll also work with parents whose young person is refusing to come in to get help of any kind, because we recognize that that's often the picture with most people of any age, actually. Typically, other people think they have a problem, and typically they think other people have problems, but very few people go, I've got a problem. Fascinating, unless you're talking about private practice, but that's another 2 minutes, right? So anyway, that's all I have to say, and if you have further questions, feel free to get a hold of me by email, by telephone, and I'll do my best to get back to you as soon as I can.
Wait times.
Wait times? They vary. Usually I would say, on average, it's maybe 10 business days. Sometimes it can get, on certain points of the year where there's a lot of referrals from schools, it might get as high as 15 business days. But the wait times are fairly survivable. And again, it's because of how we work. We recognize that you have to work with people when they're in crisis and when they recognize that they need service. So we don't want to delay that. And if somebody makes a point of saying we need something sooner, we can usually do it. I've been known to work with people from time to time. Any other questions?
Do you connect them with detox and treatment programs?
We do. We do. So we'll do a complete assessment. We find out from their point of view what's driving the problem and what they think might solve the problem. And sometimes that leads to referrals to residential resources and care beds, which are basically homes that will support them with their kind of physical needs while they're obtaining treatment from us. And withdrawal management or detox, we have a relationship with them. They're a contractor with us, so. Yeah,
So we're just wondering for the family doctors, if we want to refer a client to do treatment,
yeah.
is it best just refer to you then, and then you'll do the treatment part?
By treatment, you mean residential treatment? Yeah, it's a fairly limited resource, and we know the success of any kind of residential treatment referral depends on a community-based counseling relationship before and after that treatment. So sending a person off to residential treatment, expecting that that's going to work by itself is really unrealistic. So send them to us, and we'll take care of it. And I didn't plant those questions, by the way, but if I could plant questions, I would have planted those.
Hi, I'm Heather Vale from Victoria Child and Youth Mental Health, and this is my colleague. So basically what we thought we'd do is tell you about the general service, and Heather's going to fill you in about the Aboriginal Child and Youth Mental Health Service. You all know that we're a service for 0 to 18 years old. Same for you.
Yep, same for us.
And we deal with significant difficulties related to thoughts, feelings, and behaviors. And we also serve as a system navigator. That may be something that you're not aware of. So if you ever have something where you need a hand, you're welcome to call any of our teams and talk to the intake workers, and they'll help you figure out what to do. We are very available that way. Any differences?
Nope.
Okay. So you want to know how to access our service, and you've probably read the letter that got sent out to you telling you that at the regular teams, we have intake clinic times now. What that means is families can just drop in and have an intake meeting with one of our intake workers, and they'll leave with a plan. And with that plan, we can have it sent to you as well if you've referred, or they can take it to you and share it with the schools as well. So how do things work for you guys?
The difference between our team is that we actually do outreach. So the Aboriginal service team will go out to the homes, the communities, and the schools to conduct intakes with clients. We also require, well, we don't have really an intake clinic. We have a time on Tuesdays between 1 and 3 in which we do accept walk-ins, but we will have clients just call and we'll arrange an appointment time with them. So a little bit more convenient.
Any questions about mental health services for children and youth?
Wait times?
Oh, wait times, right. So I was asked to cover the 3 areas. So Victoria and Saanich Child and Youth Mental Health, it's under 6 months usually. For West Shore, it's about 8 to 12 months, but a lot of it depends on the availability priority and also the service provided. So you may know that we do both individual, family, groups, all sorts of things. And so it really depends on what we have running at the time, what that client needs most, and we'll try to slot them in as soon as we can.
Our service is currently 10-month wait list.
Anything else that you want to know? Yes?
Can we put our youth into any of the groups when they get to intake right away, or
If the group is appropriate for somebody at the intake level, you could, for sure, but they would definitely have to come and do an intake with the team to be put into one of those groups with the general teams.
There are, like on our team, we have some drop-in models. So there's I believe a rock climbing group and a running group out in the peninsula, as well as a transgender group, and those are drop-in, so not requiring to be on a wait list or the intake as well.
And Peter just wanted me to let you know that he realizes it's a tough system, so Peter Monk is our team leader, and that he's more than willing to talk with any of you and try to make it as simple as we can, just like we try to with the families. So if you have any questions or concerns, please feel free to give him a call as well.
Well, thank you all for being here tonight. It's been a great evening so far. So I just wanted to say some things about substance use in the first place. So the use of psychoactive substances is really tightly woven into the fabric of our society, and youth are particularly vulnerable to these complex societal imperatives and regrettably are seen to be experimenting with substances at earlier and earlier ages. And fallout from these behaviors can be abrupt, such as short-term negative outcomes, motor vehicle accident, violence, unwanted pregnancy, psychosis, even death. But more troubling, I think, is the following: a more gradual disconnection from friends and family leading to social isolation, reduced connections to school or employment opportunities, increased involvement with criminal justice system, diminished hope for the future. Our office is in the excuse me. Our office is in the Quadra Village Community Center, kind of an inner city neighborhood, and I volunteer each year at their Christmas dinner. And this past year, I was responsible for seating people, and of course, lots of poor people in the community, and they all come and take advantage of the Christmas dinner, and the little kids are all excited and dressed up. But I noticed for the first time there was a contingent of middle-aged men, perhaps 40 to 50 years old. They came in by themselves. They wouldn't make eye contact with anybody. They shoveled down their food and they left. That's a consequence of untreated youth substance disorder, right? So really have to get cracking on it sooner. So perhaps this is not what you were expecting to hear, but much of what we at Umbrella know about working with youth, we learned from our experiences with adults. We learned that unsolicited advice is always perceived to be criticism by the person receiving it. So we don't tell people what to do. We listen. And research indicates that when helpers can exhibit genuine warmth, display accurate empathy, and can hold the client in unconditional positive regard, favorable outcomes are much more likely. At Umbrella, we strive to build safe, supportive, and accepting relationships where people, young and old, are empowered to make their own decisions. Instead of meeting in an office setting, we often meet clients in a comfortable coffee shop. Youth are particularly receptive to Umbrella's informal approach and respond well to outreach team members, all of whom have experienced addiction themselves. Young clients do not age out of Umbrella supports. They're welcome to stay connected for as long as our services make sense to them. Adult resources are fragmented and can be challenging to navigate for people that are just graduating into that world. We welcome referrals from physicians, family members, or the youth themselves. Umbrella's family support program might even be able to help a youth concerned about a friend. Referral process, simple. Between 8:30 and 12:30 in the morning on weekdays, call 250-380-0595, and that's all it takes. Very, very informal process, very low barrier. We don't turn anyone away. Follow-up for youth is about a week, slightly longer for family members, slightly longer still for people that have been around the block a time or two. So, any questions?
Would you recommend doing, as a physician, doing this sort of referral for someone that's kind of resistant to?
Probably not. No. It usually just leads to a blind alley somewhere down the road. Yeah. It's a bigger topic than I can really get into tonight. We're engaging in a pilot project with a select group of family physicians right at the moment that should help to see how we can best facilitate those kind of things. So we might be able to talk at some future date about how we could come and meet with you and the youth in your office and see if we can maybe move the needle a little bit at that point. That's it. Good. Thank you.